My name is Brianne Roan. I'm a nursing student here at Chamberlain, and I'm here to do my medical administration checkoff. My patient here is Mr. Teddy Roan. I have my MAR sheet that was prescribed to me given to me by the doctor on call. Listing the list of drugs. I will now go to the medication room where I will go and use my MAR to determine what medications I'll need for today. As we can see from the MAR, we will need insulin, 5 units, subcutaneous once daily. We will need Tylenol, 500 milligrams PO to administer now. We've confirmed from my MAR that we have the right drug, right dose, and right route. We have our patient, Mr. Teddy Roan. We have his date of birth, 12/26/1996. From the MAR, we can see that he doesn't have any allergies, any known allergies or contradictions. Okay, now that I've verified the MAR once, I will get my medicine. We have the amphetamine here, the Tylenol that's supposed to be given. We will fill up the needle with the insulin, about 5 units, and then we will cap back the unit with a 1 swoop hand motion. Now that I've double checked the MAR sheet, I will ask a colleague of mine, Miss Sarah, would you mind double checking that I have the right medicine that was prescribed to me by the doctor? I have the Tylenol, which is 500 milligrams by mouth, to give once now. And we have the insulin, about 5 units subcutaneous daily, once daily. Is that okay? You confirmed it as well. Gotcha. Now I'm going to enter the patient's room. I'm going to leave the medical room and I'm going to go to the patient's room. I have everything in hand. I'm going to knock. Mr. Teddy, he would then tell me to come in. We will close him off, give him some privacy. I'll perform hygiene again. I will verify Mr. Teddy's name and date of birth on his wrist bracelet. Teddy Roan, 12/26/1996. That matches my MAR that I've placed on my bedside table in a sterile environment along with my medications. Okay, Mr. Teddy, I'm here to give you about 2 medications today. We have the insulin, which is 5 units subcutaneous once today and then daily. And then we have the Tylenol, which is also known as amphetamine, which is 500 milligrams PO, 1 dose now to break your fever, and insulin is for your blood sugar. Is that okay? And Mr. Teddy, I see here that you don't have any known allergies or contradictions. Is that okay with this medicine? Are you familiar with these routes of medicine? Okay, no known allergies or contradiction. Sounds good. And Mr. Teddy, would you prefer to have your insulin or your Tylenol first? Insulin? Gotcha. The patient has requested that we give the insulin. I'm just going to double check that I have my insulin here in my bedside sterile environment. I'm going to once again look at my MAR to see what I'm administering to the patient. Okay, Mr. Teddy, we're going to just move your clothes down. Inspect the area. There's no signs of any wounds, rashes, or any swelling or any redness within the injection site. We will then perform hand hygiene and don my clean gloves. Okay, Mr. Teddy, I have my alcohol wipe I'm going to use to wipe the injection site, which is about 1 inch above the umbilicus. Now that we have wiped that area, we will disregard that into the trash bin. We will let that dry. I will then pick up my injection, my needle, which is my insulin, my 5 units. I will then hold the subcutaneous tissue with a grip to see my area, insert the needle at about a 45 to 90 degree angle. Okay, let go of the tissue as I'm placing the needle in. Relax with my non-dominant hand holding it in place. The needle is done, I'll pull it out about the same angle. Disregard that into the trash bin. Use a cotton ball to stop any bleeding or anything. Okay, now I'm gonna inspect the area, make sure there's no swelling, any onset of any rashes or anything. Disregard that into the trash bin. I will now pick up my Band-Aid, place it on the area, roll up Mr. Fix's clothing and his blanket. I will then take off my clean gloves, perform more hand hygiene. Okay, Mr. Teddy, it's time for the amphetamine now. I've already performed my hand hygiene to move on to the second step of administration. And Mr. Teddy, do you have any difficulty swallowing that you know of? Good. So to make you more comfortable, I'm gonna put you up to about a 30 degree angle so we don't have any trouble with you swallowing or choking on your medication. Is that okay? Good. Okay, Mr. Teddy, I'm gonna make sure that I have my amphetamine here in my cup. I will make sure I have a cup of water with the straw so the patient can drink and swallow the medication down. Okay, Mr. Teddy, that's good. Mr. Teddy has taken his medications. We'll dispose of anything that we used in the trash. I will then perform more hand hygiene. And Mr. Teddy, I'm going to remove you from the 30-degree angle and lay down on your bed flat. Go. Make sure the bed locks are on. Pull up the guardrails if applicable. Make sure to verify that the patient has the call light. And Mr. Teddy, did you have any more questions or concerns for me today? Okay, and now that we've administered both medicines, we're good to go. We will not have to administer it from the MAR. We can tell that we won't have to administer any more medications till tomorrow. Okay, Mr. Teddy, I hope you have a good evening. And if you have any questions or concerns, you know where to find me.